You have cancer. Three words that nobody wants to hear. But when the diagnosis is given to a child, it is even more devastating. While most childhood cancer can be cured with generic medicines and other forms of treatment, according to the World Health Organization, less than 30% of children diagnosed with cancer in low and middle income countries are cured, compared to over 80% in high income countries. This brings us to the story of Tanaka, an avid sportsperson who excelled representing her school in several disciplines. One day, she fell and fractured her hand. One thing led to the next, and she was diagnosed with bone cancer. Her parents, both civil servants in Zimbabwe, struggled with the medical bills and were devastated when they could not afford the recommended treatment to manage Tanaka's condition. Cancer treatment is expensive in Zimbabwe and continues to be a major barrier to access for many ordinary people like Tanaka's family. For some time, they relied on well-wishers, family members, concerned friends, and community members who offered their help and support to the family. While on a visit at Paediatric group of hospitals, the parents came across a palliative care provider in the children's oncology ward who referred them to KidsCan Zimbabwe, an organization that supports children with cancer and assists with clinical care and psychosocial support for the affected children and their families. They also support with basic needs when necessary. KidsCan Zimbabwe supported Tanaka's family with the exorbitant medical bills for treatment, including chemotherapy and other prescription meds. Tanaka had to undergo a complex and expensive surgery for her hand that included grafting of bone from another part of her body. Ordinary people cannot afford the cost of all these treatments in Zimbabwe. Sister Kawadza, a pediatric oncology nurse who was also trained in palliative care, visited regularly until her full recovery when she was declared cancer-free. Tanaka defied the odds of being diagnosed with cancer in Zimbabwe thanks to early diagnosis and the help from KidsCan Zimbabwe. Equity in healthcare access is imperative to make a story the norm instead of an exception.
According to Dr. Emmanuel Luyirika, the Executive Director of the African Palliative Care Association, the time is now for African governments to fund universal health coverage schemes covering health promotion, disease prevention, early detection and diagnosis of diseases, treatment, rehabilitation, and palliative care.